Good morning, everyone. My name is Tanya Mushynski, and on behalf of the Community Foundation of Mississauga, I'd like to offer all of you a warm welcome to today's vital conversation. I'm your moderator for today's vital conversation discussion on food security and health. I'd like to confirm that today's session is being recorded and will be available as an ongoing resource on the Foundation's website. We begin our session today by acknowledging that the land on which we gather and on which the region of Peel operates is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are truly indebted to all First Nation, Métis, and Inuit peoples with whom we share this land, and we pledge that we will seek ways to support and help Indigenous peoples achieve the 94 calls to action that were issued by the Truth and Reconciliation Commission and do so in a timely manner. We call on the various levels of government to continue to address the inequities that the Indigenous peoples face on a daily basis and allow them to take their rightful place on these lands. We also acknowledge the systemic discrimination that many groups face who call this land their home. They came here to seek a better life or to broaden their horizons, but because of the color of their skin, their religion, or some other characteristic, they are subjected to discrimination. As we deliberate and discuss matters today, let us commit to respect and uplift each other, to tear down the barriers of prejudice, discrimination, and hatred that seem to be getting stronger. Let us resolve to love ourselves and each other and to build a just society for all. Today, we will survey the food security challenge in Mississauga. Particularly, we will be looking at the issue from the lens of vulnerable populations like newcomers and their experiences as they arrive in Mississauga. The discussion will revolve around predetermined key questions, but we would love the opportunity to incorporate questions from the audience. If you have questions related to the discussion, please feel free to introduce yourselves, put your questions in the chat section, and we will try our best to accommodate them at the end of the discussion. Community Foundation of Mississauga staff will be monitoring the chat for any technical issues that are brought up by audience members. We would like to acknowledge and wholeheartedly thank our sponsor for today, Novo Nordisk, who is supporting the Vital Conversation series. Today's session is the second of 3 events in the current Vital Conversation series. A recording of the first event that happened on October 27th is available on the Foundation's website. Vital Conversation events are designed to address some of the pressing needs impacting the City of Mississauga by gathering thought leaders and community activators and providing a forum to exchange opinions, ideas, and solutions. Today, we welcome guests from all walks of life in the City of Mississauga and Peel region, including residents, community groups, individuals from various charitable organizations and sectors, as well as donors and philanthropists. And we'll start by way of introductions. Again, my name is Tanya Mushynski, and I'm a volunteer member of the Community Leadership Committee of the Community Foundation of Mississauga, as well as a board member of the Community Foundation of Mississauga. I've worked in the energy sector for over 20 years, and I'm also the mother of 2 teenage boys. Our first speaker for today is Megan Nichols, CEO of the Mississauga Food Bank. With a career path focused in the nonprofit sector, Megan has worked with organizations dedicated to social causes such as women's development, international relief, and youth mental health. Driven by a passion for ending hunger and seeing poverty reduced in her own community, she is proud of her contribution over the last 12 years to the significant growth of the Mississauga Food Bank. Megan was named CEO in 2018 and now leads the food bank team to work towards their vision of a Mississauga where no one goes hungry. In addition to her love for the nonprofit sector, she loves her husband Alex, being an auntie, her 2 cats, new technology, and a good cup of tea. Welcome, Megan, and thank you for joining us today. Our second speaker for today's discussion is Ahmed Mirza. Ahmed is a landless farmer and co-chair of the Peel Food Action Council. Ahmed has several years of experience working in agriculture, not-for-profits, and with community organizations. Ahmed works to build networks and relationships within the food system to help improve food security and bring awareness to food justice. Welcome, Ahmed. It's a pleasure to have you here today. Our third speaker for today is Adam Marcella. Adam Marcella is the Director of External Affairs for Novo Nordisk Canada. Since 2018, he has been involved in numerous public-private partnerships working to reduce the societal burden of chronic diseases like diabetes and obesity through improved understanding and disease prevention. In collaboration with others, Adam has helped to bring diverse groups together to work on shared societal objectives, including Cities Changing Diabetes, a global program now operating in over 40 cities worldwide, with the aim of driving action against type 2 diabetes and obesity in cities and reducing health inequities. Mississauga is an active city in the Cities Changing Diabetes network. Welcome, Adam, and thank you for joining us today. Through our discussion, we hope to understand the major issues related to food insecurity amongst Mississauga residents and the associated health impacts, and explore some unique solutions to inspire lasting change in the community. Food insecurity can seemingly be an invisible problem. It can often go undetected unless people reach out for help themselves. And often members of the community learn about the issue through the news or their charitable interactions. But it affects many households in our communities, and a bigger impact is usually felt by more vulnerable populations, like newcomers, low-income families, and single-person households. The challenge is significant. The availability and affordability of food permeates issues like economic status, physical and mental health, social stigmas, and the very dignity of people living in our neighborhoods. Before we move on to the discussion, we'd like to conduct a few general knowledge polls on the food security issue with our audience. You'll be prompted on Zoom to respond to 3 polls, and we'll give you about 15 seconds for each response. So first, let's look at the issue internationally. Our first poll question is, what percentage of increase in food prices causes 10 million people in the world to sink into extreme poverty? Is the answer 1%, 5%, or 10%? That was close. The correct answer is 1%. According to the World Food Program, 1% of increase in food price causes 10 million people to sink into extreme poverty. Now let's look at some facts on the national level. Our second poll question is, in 2021, what percentage of households in Canada experienced some level of food insecurity? 13.4%, 15.9%, or 18.6%? Thanks very much for your participation. So the correct answer is 15.9%. According to Proof, a food insecurity research program by University of Toronto and partner organizations, in 2021, 15.9% of households, or 5.8 million people in the 10 provinces, experienced some level of food insecurity, of which almost 1.4 million were children under the age of 18. Finally, we'll explore some facts on the city level. Our third poll question is, in Mississauga, what is the average monthly income for a food bank user? Is it $1,531, $1,874, or $2,059? Again, we appreciate your participation in the poll. It's interesting to see how close we are to the correct responses. So the correct answer to this question is $1,531. According to the Mississauga Food Bank's 2022 Annual Impact Report, the average monthly income for a food bank user is $1,531. Additionally, the report states that based on data from Stats Canada, 1 in 10 people in Mississauga are considered low income. That's 66,740 neighbors in need. So here are some additional key facts from the Mississauga Food Bank's The Face of Hunger in Mississauga Annual Impact Report 2022. First-time food bank users represent 24% of all food bank users. 45% of food bank users go without food for at least one meal each month, while 46% of food bank users have gone into debt to buy food. These are some concerning statistics which require a deeper reflection. So we'll dive right into our first key question for today's discussion, which is, what are some of the prevalent issues related to food security in Mississauga, and how do they affect vulnerable populations disproportionately? For instance, newcomers and low-income groups. And Megan, I'll start with you first, since you're the CEO of the Mississauga Food Bank. You'd have a great pulse of the food insecurity dilemma in the city, surely from a demand perspective. So considering the makeup of a city that has a burgeoning newcomer population, could you please offer your thoughts on some of the prevalent food issues that you've observed in recent years and give us a sense of the groups that are more vulnerable to food insecurity?
Absolutely. Thanks for having me. Thanks to the Community Foundation for hosting this great discussion today. You know, when we look at food insecurity, really the issue isn't actually about food, it's about income. And the reason that vulnerable populations are vulnerable is because of financial and material poverty, which is what results in food insecurity. And all of these things are really tied together. So all of our official, social structures, social assistance, affordable housing, childcare, and then like unofficial societal structures, racism, NIMBYism, all of these things contribute to poverty and food insecurity. We've seen over the last number of years that a disproportionate number of people using food banks are people of color. So it's a much higher percentage of our food bank users that are people of color than are represented in the general population, which shows us there's directly related to systems that have built on that foundation of racism. And then here in Ontario, almost 2 out of 3 people using food banks are social assistance recipients. Ontario offers 2 programs, Ontario Works and the Ontario Disability Support Program. And if you're a single person on Ontario Works, their rates would put someone $1,300 below the poverty line. So the government support that's provided doesn't even bring people up to that. But there's even more of a gap because the market basket measure, which is what we use for a poverty line, doesn't even take into account additional costs related to having a disability, caregivers, mobility devices, and that's even after last year's 5% increase rate. And then I think the segment of society that perhaps we wouldn't think of that we see a lot at the food bank has been single people, especially if it's, kind of crossing intersectionalities where someone's single and has a disability, single and a person of color. But if you only have one source of income or one source of social assistance and you can't combine incomes and split expenses, for an adult to make it on their own and buy the food that they need, that's a group we've really seen growing in terms of using the food bank over the last number of years.
Megan, thank you so much for sharing your extremely valuable perspective. We appreciate it. Now, Ahmed, we'll come to you. You're co-chair of a grassroots organization that's actively working with stakeholders from across Peel region to create a just, sustainable, and secure food system. So from your perspective, what are some of the food security issues in Mississauga that stand out, and what communities do you feel are overly burdened in this crucial situation?
Hello, everyone, and thank you so much, Tanya, and thank you to the Community Foundation for holding this talk. There are a lot of issues, unfortunately, within the food security framework. Just as your initial question suggested, there is a really tight margin when it comes to food security. 10 years ago, there were 1 in 10 people in Canada were attending food banks. Now the number has increased to 1.5 to 2%, something like that. But that increase is a significant amount. A large portion of the population in Mississauga, it's a very diverse, multicultural, international city. We have people coming here from all over the world. So you have people, low-income people, new immigrants that are not getting necessarily the food that they need, and then this, in turn, really affects their health and their well-being. Food security, despite what people might think, is actually a public health issue, because not having the correct and adequate access to food essentially prevents you from being able to live a healthy, nutritious lifestyle. A lot of these people, unfortunately, that are in the low income, that are new immigrants, and their families, their children, they end up not being healthy. They have a more wider area of health problems, which in turn then affects the healthcare system. And we are trying to come up with better and more creative solutions to solve some of these issues.
Again, a very valuable perspective. Thank you for sharing that. We wouldn't have known that from on the face of the data that we see in this area. So really appreciate that, Ahmed. So we'll switch gears now and move on to another matter closely associated with food insecurity, which is what are the long-term health impacts of acute and chronic hunger on vulnerable populations? So for example, newcomers or people with comorbidities. How do the impacts tie in with the diseases in the local population, such as diabetes? And for this question, we'll move the spotlight to Adam. Adam, you've been very involved in coalescing diverse groups on community-oriented initiatives, including the city's Changing Diabetes Initiative, which is a global program addressing type 2 diabetes, obesity, and health inequities in cities. So could you please share some information with the audience on some of the key findings on the axis of health and food shortages, and perhaps talk about the relationship of the issue with some of the prevalent diseases in the community?
Thanks, Tanya. It's really good to be here this morning. Hopefully I can offer a different and complementary perspective based on some of the work that we've done in recent years, both in Canada and globally. I really do look forward to the discussion today. I already learned a lot listening to Ahmed and Megan on our prep call earlier this week. Also, full disclosure, our office is in Mississauga, but I live in Georgetown, so thanks for overlooking that detail and inviting me anyhow. So Novo Nordisk, we're a biopharmaceutical company. We're headquartered in Copenhagen, Denmark. We've spent the past almost exactly 100 years developing and manufacturing medications for chronic diseases, and that includes type 2 diabetes and obesity. Even with all those advances on the medical sciences, or in the medical sciences sphere over the past century, we still see chronic non-communicable diseases rising at an alarming rate, and that's not a Canadian statement, that's a global statement. It tends to go up with urbanization, and it tends to go up as people move into cities. So while we as a company aren't directly working in the food sector, I'm less qualified to talk about food security than my two co-panelists today. We're not involved in food supply chain, we're not involved in agriculture. But when we look at rising rates of diabetes, more specifically type 2 diabetes, we look at rates of obesity. I'd encourage all of you on the call, if you haven't looked at Canadian rates of obesity relative to other OECD countries, take a look at that. It's not an encouraging picture. And I would say that what is going on is entirely unsustainable, both for healthcare systems across the country, but also for Canadian society more broadly. So not-for-profits, employers, governments, etc. So you really can't talk about positively impacting rising rates of diabetes, obesity, other chronic diseases without also talking about things that are far upstream of the conventional healthcare system. And that's the social determinants of health. So that includes things that have already been mentioned, things like income, food security, housing, social connection, and the flip side of that, social isolation. If you're a newcomer, do you have the social structures in place to actually support you living your best and healthiest life, built environments in neighborhoods? So Tanya, that's a long-winded way of getting to answering your question, but the long-term health impacts of acute and chronic hunger, we know that multiple lines connect poverty, food insecurity, and obesity, and that obesity is a very strong, maybe the strongest risk factor for developing type 2 diabetes. We also know that one of the most important connections is just simply poor food quality. And when I say poor food quality, what I'm really talking about are highly processed, high fat, high salt, high sugar, long shelf life foods that are almost always the cheaper option. So I think about a poster that I saw presented a few years ago with an Indigenous community in another region of the country where, you know, the chocolate bar is under $3, and this is going back 4 years now, so maybe it's gone up a little bit. The chocolate bar is under $3, but the half rotten head of cauliflower is $22, right? So any of us faced with that decision, I'm probably buying the chocolate bar just based on the decisions that are in front of me. So maybe I'll stop there.
I really appreciate that that complimentary perspective, Adam. Thank you very much. Megan, now your organization assists a diverse mix of population with their food needs, including recent immigrants and BIPOC communities. So would you like to comment further about the unique health challenges that you've observed with food insecure households?
Yeah, we know from one of our agencies, the Mississauga Food Bank is the central food bank for the city of Mississauga, and we provide food through a network of over 50 agencies. And so one of them is the Canadian Mental Health Association's mobile health clinic. And we were able to provide them fresh food to be able to provide to those they go take their mobile health clinic to. And when they joined our agency network and we started providing them with fresh food to provide to their clients from the mobile health truck, they immediately saw quantifiable improvements in health measures like blood pressure. And so we know for people with specific dietary requirements related to their health, like low sugar diets, low potassium, or others like that, it is really vital for them to get the kinds of foods that they need, but it's so expensive to do so. And, as Adam said, packaged and processed foods are often less expensive and more accessible. And so we work to fill those gaps and provide customized hampers especially for homebound neighbors in our food bank to home delivery program, which I'll mention is supported by the Community Foundation and our friends at Novo Nordisk. And that means those folks who are seniors or have disabilities or are pregnant or parenting and don't have another adult in the household, that we can ensure they get the right types of food that their diet prescribes. And it would have been otherwise impossible for them to do that. And of course, newcomers have specific needs as well. We want to ensure that when newcomers come to Canada, that charities like food banks aren't assumed to be able to pick up the slack. We're very stretched at the food banks, especially right now. The numbers have never been so high. And, adding additional groups that we're being tasked with serving, does make a challenge in terms of us being able to provide the right types of healthy food and not just relying on some of those staples. And so, I think food banks were originally thought, back in the early 80s when they started as something that was temporary during a recession. And so it was okay if you temporarily needed to have boxed and canned foods. But Canada's policy choices have resulted in so many people struggling in poverty for so many years that food banks have had to adapt our model to say we can't give people emergency temporary food when this is what they're getting all the time. We have to change the mix of our food and ensure that it provides for people's healthy needs. If this is what they're going to have to do to survive, we want them to be able to survive in the healthiest way possible and reduce the strain on the other systems in our communities.
Well, thank you so much for the unique services that you and your organization are providing. Again, really valuable information for all of us to take away from this conversation. So in terms of the correlation between food security and health, now we can talk about the role that the built environment plays in this puzzle. So our third question is, how does the built environment impact food security, and how can community groups in the city of Mississauga work together to support food security? And for those in the audience wondering what we mean when we say built environment, In an urban context, the built environment is a conglomeration of the physical features of the city and their design, like the transportation system, parks, food system, housing, etc. So the graphic that you see on the slide here illustrates all of these features and what an ideal, healthy built environment should be comprised of. So Ahmed, we're going to come back to you. Your organization created a food justice report and community toolkit in 2021, which alludes to this very issue about how the built environment can cause issues with the availability and accessibility of healthy food, particularly for BIPOC and newcomer communities dealing with food deserts. So would love to hear your thoughts on this issue, and if you wouldn't mind, could you also briefly explain the concept of a food desert?
Thank you again, Tanya. So a food desert is a location geographically where in any specific area, you do not have access to nutritious or culturally relevant food within a certain area of either driving or walkable area. Then this term is also related to a food swamp, where you have a location where in any geographic area where you do have access to food, but the food then is just not nutritious or not of high quality, maybe a lot of fast food. Then again, there's another concept, which is a food oasis, which is increasingly rare, where you have plenty of access to nutritious food and it's readily available. In a place like Mississauga, in the built environment, a lot of us drive, a lot of us use cars. People that are low income, newcomers to the country, oftentimes do not have access to a car. Oftentimes they need to take public transportation. As you can see today, it's very, very cold outside. Imagine if you are already low on funds and then you need to go far away to access the food that you need to maintain a healthy level of nutrition. A lot of times, and this is been surveyed across Canada and even in the United States and in Mississauga, actually, the places where we have food deserts, where there's little to no access to food, the populations that live there are oftentimes Black, Indigenous, people of color. They're again new immigrants, and what this does is this disproportionately affects those populations, and then they have higher rates of diabetes, higher rates of health issues, and this is something that we're trying to avoid. What the city of Mississauga can do, at least from the terms of the Peel Food Action Council and the other stakeholder organizations we work with, we're just trying to create more accessible alleyways to food, and we're trying to bring awareness to these issues. A lot of people are not aware of these issues, but it's very prevalent in our city. If you look at Mississauga, if you look at, for example, areas by the airport or areas by Lakeshore, there are locations where people might live, but you leave your house, it is not easy to go outside and simply get food, whereas other suburban neighborhoods, you can very easily access some kind of nutritious food space right across from you. And not only that, but also there, especially in the current economic times, we're also having price that is becoming a huge factor as well. Sometimes someone might leave their house, they need to access a grocery store that is within a price range that they can afford, but then they're finding themselves having to go farther away. So these are issues that we are currently working to, like, hopefully find better and better solutions to within the community.
Thank you, Ahmed, and thank you so much for the work you're doing to bring attention to these issues. Megan, back to you. The Mississauga Food Bank works closely with vulnerable populations like newcomers and BIPOC individuals who, as Ahmed identified, are likely to live in areas that are potentially food deserts. So what are your thoughts on the built environment's relation to food security and how the city of Mississauga can bring together diverse groups to work collectively on this issue?
Well, I think it speaks to how interconnected all of these challenges are. You know, the built environment that allows people to walk to a local grocery store contributes to their health in more ways than one. You know, accessible transportation, locally grown food, contributing to all of these. It's all part of the same, you know, affordable housing and I think part of the challenge is that these intersecting issues, housing and grocery, I mean, people need houses to live. They need somewhere to live. People need food to live. And yet both of those industries are governed by how folks make money. And so how do we take a human-centered approach to food, take a human-centered approach to housing to ensure that those industries are meeting the needs of people and not the needs of shareholders? And I think that's where we have so many things where it's not profitable for a company to put a grocery store in close location to low-income apartment buildings and housing, but those people need to eat. And it's not, some of these other interventions are not going to make the most money for a company, and yet their decisions that are being made then aren't meeting the needs of the humans that are there. And so, this is how affordable housing and, thinking that through really plays into it. We've seen a lot over the last few months, affordable housing and building housing in Ontario has certainly been, kind of in the news. And, it's vital to make sure that if we're going to have affordable housing, we can't say we don't want it in our neighborhoods. It has to be in neighborhoods where green space is accessible, where food is accessible. And, it's vital to consider that when we fight for housing, we have to also think about all these other supports that need to be available for people as well, that any of us would need to get by. And we all want to live in close proximity to things that are convenient for us, but also that are going to make our lives, more healthy and whole. And so we know that food programs and community supports like ours fill in the gaps in neighborhoods. But my true dream is for people to be able to live in neighborhoods where they can access and afford the food that their neighbors afford and access in the same places their neighbors access it, and that there's less of a divide between the people who have and the people who have not, and they're able to live in community in that way together. And I think that's the vision we all have, is for that kind of holistic health in our communities.
Well, again, thank you for everything you and your organization are doing to bring us closer to that vision and dream. And I appreciate you sharing that with us today, as well as helping us appreciate more how interconnected all these issues are. I think everyone in the audience is probably coming to that realization, as am I. So Adam, I'm going to bring it back to you. I'm sure the issue of built environment comes up in the city's changing diabetes discourse. So could you shed some light on this global initiative and how we can continue to make improvements in this area?
Sure, thanks, Tanya. And a couple of points from what Ahmed and Megan were talking about. I'd never heard the concept of a food oasis before, Ahmed, so thank you for that. It's kind of like the reverse and the positive spin on it when you actually find yourself in a good living physical environment. And Megan, that concept of human-centered approaches to food and housing, I think too often we get away from that, and that's where you end up with the NIMBYism and some of the other things kind of creeping in. I'll start off by saying that we know, and I like this figure a lot because of the simplicity of it. Like, it actually clarifies for me exactly what it is that we're talking about. Like, built environment and healthy built environment, it's not an abstraction, right? Like, these are things that all of us interact with on a daily basis. And I won't go on a tangent here about bike lanes, picking on my own municipality, but I have some very strong opinions on bike lanes and what constitutes a good bike lane. But maybe just as taking a step back, we know with very little doubt that built environment impacts health in many ways, including in relation to food access and food security. From what I've seen and what I've read, and there's some excellent local research that's been done here by the University of Toronto, it tends to happen at the level of neighborhoods. So your neighborhood, all of our neighborhoods, that's where we buy, access, and prepare food and consume it. It's mostly at a local grocery store, a food bank, or a restaurant where you're acquiring the food that you and your family are consuming. And that ties in with a host of other issues like walkability, community safety, housing, access to reliable transit, and it goes on and on. So about 9 years ago, Novo Nordisk started the City's Changing Diabetes program. You can punch that into your search engine and kind of see what that's all about. It's a global program. It had an initial focus of coming up with grassroots community partnerships for development of fit for place interventions to address rising rates of diabetes and other chronic diseases, specifically in cities. And while that program, and it's now operating, actually it's now more than 45 cities worldwide, it wasn't specifically focused on food security. I find it really interesting that many years later, we find that many of those collections of community stakeholders from different cities and different parts of the world, they've often landed on interventions that sit somewhere between built environment and food security in some combination. So that what that's telling me is that people close to the issues are coming up with solutions that sit in this space of healthy built environment. So part of the answer to me is that community groups, the city, private sector organization, anyone else who's got something positive and constructive to offer, coming together to design fit for place interventions in collaboration with each other, that's a part of the answer, at least for me. There's an excellent and fairly recent Cities Changing Diabetes example from Houston. The program was called A Bite of Hope. It existed pre-pandemic, but then when the pandemic hit, they basically designed an intervention. It involved, maybe very similar to some of the work that Ahmed's done, it involved partnering with local family-run restaurants, often owned by members of the BIPOC community, to offer healthy menu options with more local sourcing of fresh ingredients, while also not negatively impacting the profitability of that small family-run business. But we have no idea if an intervention like that would work in Mississauga unless the right stakeholders get together to design a solution that could work in the local Mississauga context. And maybe I'll leave it at that.
Well, thanks, Adam. I love that concept of collaboration to achieve results for these populations. Thanks for sharing more about that inspiring initiative. So we're moving on to our next question as we shift our focus from the issues and start exploring ways to resolve the food insecurity problem. I'd like to ask the speakers, how can we improve equitable access to not only food, but healthy food for all residents in Mississauga? And I'd like to start with you, Megan. So how do you feel we can improve equitable access to healthy food in the city?
I think, putting food in physical proximity to where people are and informing them of where they can get it, is a great start, whether it's people buying it through the regular system or needing to find it from emergency support. But I mean, the thing I've become more passionate about over the last couple of years is that equitable access to food won't only happen when people have equitable access to other things. And so, the food bank's role in terms of improving equitable access, to be honest, we don't really do that part. We are a Band-Aid. The food bank is a proud Band-Aid. And, and we're here to provide emergency food. And however, as more and more people kind of need our Band-Aid, we have to be looking at what causes those cuts in the first place, what really is resulting in so many people needing the food bank at this time. And so we're trying to do a good job at ensuring that local access, adding additional programs that'll put food in neighborhoods where there isn't access to food, partnering with organizations like Ahmed's, finding locally grown produce, sourcing it from farmers, and doing all kinds of sometimes it seems like crazy things to try and get enough food into Mississauga. But at the end of the day, we're trying to, increase some of that focus upstream to prevent those, really falling into more poverty. And how can we lift, that population of the city that lives in low income up to a place where they have enough income, not just to survive, but to live. And, like seeing those pictures on the screen here, those beautiful greenhouse grown lettuces, everybody deserves access to that same quality and quantity of great food that Canada has to offer. But until we start treating food as something to which people have a human right and changing the structures to ensure that human right can be met. Band-aids will continue to exist, and we'll continue to have to do health-related interventions, related to diabetes and related to all these other challenges.
It's fascinating how the role of the food bank has evolved. So thank you for sharing those insights. I'm going to move over to you, Adam, now and ask you what are some of the ways you think we can improve equitable access to healthy food for all residents of Mississauga?
I think just in brief summary, to echo something that Megan just said, because I couldn't agree more, equitable access to food happens when you have equitable access to other things. And that includes employment opportunities, it includes affordable housing, it includes all those other social supports. And one thing that we also need to consider, with Canada being a country largely focused and a long history of high levels of immigration, that's what we are as a country. In addition to our Indigenous communities that were already here and understanding that dynamic, there's also the issue of social isolation. If somebody comes here and doesn't have a support structure around them, equitable access to many things falls by the wayside in those early days, early years even, when they're here. And helping to support newcomer communities is a big part of, I think, what our society hopefully stands for. And so maybe I'll leave it at that. It's a short answer, but everything that Megan said, and I think rings true to me.
That's a great answer, Adam. Again, helping us all see the connections between these issues. So thank you for that. And Ahmed, I'm sure you're keen to share your thoughts on this issue, given your organization's work on food justice in Mississauga. So what solutions would you propose to improve equitable access to healthy food?
Yes, thank you again, Tanya. When it comes to equitable access, again, the Peel Food Action Council, we are very concentrated on food justice, and food justice is a little bit of a different concept than food security. Food justice is more around the equitable production, access, and distribution of food. So food security then is more in terms of, do you have access to food secure? Are you food secure? Like, do you have food available to yourself to eat, or do you not have food available to yourself to eat? So these terms are fairly similar, but a little bit different. And the overlap, there is a lot of overlap, and it influences us in terms of a social community organization, because when we try to drive or push policy, then we pull from our food justice theories and ideas, and then we see how we can implement that into a food security framework. So in Mississauga is a fairly well-to-do city. We have a lot of resources to create equitable access. So at least from the perspective of the Peel Food Action Council, we are trying to come up with some creative ideas. The thing is, people need food all the time. There's a pretty common saying that someone told me a while back: you might need a lawyer or a doctor or a priest once in your life, but you need a farmer 3 times a day, every day. So when it comes to food for us, we are trying to we're trying to create additional alleyways for access. If I can give you an example, a lot of farmers markets run during the mornings, they run during the daytimes. Although maybe the people that are going there are not necessarily food insecure, they are seeking out nutritional food. What the Peel Food Action Council, for example, we are trying to maybe make also a nighttime food farmers market that is farmers market themed, and that will also have access to different nutritional food, but also potentially education, because then you have a whole younger demographic that they do not maybe go to farmers markets in the morning, they will maybe go in the evening, and then we get an opportunity to not only give them nutritious food, but also potentially give them some education. And we are trying to develop programs like this all across the region. some of the other ones, just food for your thought, potentially that I know of that are being run in different parts of the world. People are creating not-for-profit grocery stores, food co-ops, farm to school programs, and these are the type of programming that we're hoping to create within Peel region and specifically Mississauga, because we feel like we have the necessary stakeholders and interest groups that really have put a lot of hard work and time into food security for many, many years, that are ready for a shift and a change in perspective to potentially include food justice perspectives.
Wow, those are some really innovative approaches. I love those examples that you've shared with us. Thank you. And I won't forget that, meeting a farmer 3 times a day. So now I'm going to bring us to our last question. We're going to round out our discussion with perhaps the most critical question. What are some tangible policy solutions to mitigate food insecurity problems in Mississauga? And you know, I'll come back to you, Ahmed, based on everything we've discussed today. What you think some policy solutions are that you'd like to see implemented at the community level?
So again, thank you, Tanya. And I'm basically an agriculturalist and a farmer, and the Peel Food Action Council is an organization. It is more a collection of different stakeholder organizations that work within not only food security, but also urban agriculture and their food interest groups. So in terms of tangible policy solutions, we are doing advocacy to potentially try to change some public policies. Obviously, the one that we touched on multiple times through this whole call today was in regards to income, base income. People who are low income have a harder time accessing food. But food and the food security world is very complex because there's so many different moving parts, especially not just in the space of Mississauga, but also in the time of where we are at, not just as a country, but also in the environmental space. We are experiencing climate change. All these things are going to be affecting us as we move forward. So one perspective of the Peel Food Action Council, at least one thing that we're trying to do, is we are definitely trying to create educational programs for the kids, for the youth, for even the adults and the elderly, seniors, everybody in the community, and for people that are from outside the country, to really educate them about a lot of the concepts we discussed today, because ultimately food security is a public health issue. We want to relate that to people, that there's a public health issue going on, but also that it is possible for people to be able to take care of themselves, improve their personal health. So we are trying to work with Peel Living, which is the social and community development housing. We're going to be putting up a few private community garden spaces. In addition to that, we are working with some faith-based groups and the Peel District School Board. Hopefully we'll be setting up an aquaponics lab with them. So we are working on multiple programs there. Then in addition to that, we're setting up a volunteer network to help us work with all these different food events and gardens and food forums that we're hoping to throw and that we've already been throwing. Unfortunately, COVID and restrictions did delay our strategic growth policy or plan that we had. So in the coming year, in 2023 and then moving into 2024, we are very excited. We've already opened some community garden spaces. We already worked with a lot of organizations. We're hoping to work closer with the food banks and develop some new policies. And then once we get more people on board, we get more people educated, and we get the correct stakeholders at the right tables to have the correct conversations, we are hoping that that will create the necessary policy shift and advocacy required to really change some things that are really necessary moving forward in the way that Canada is moving. As we all know, our government needs, like they are bringing in more and more new immigrants. Our country needs immigration, unfortunately, just because of our economic design. We are going to be facing more and more challenges. Mississauga, I believe, is the largest suburb in North America, which puts it at a very unique space in terms of where it is, population-wise, demographically, everything. So it's going to take a lot of work, but we're in a very good place in terms of the fabulous organizations we have to potentially work with. A lot of people are willing to do a lot of creative new ideas and make some amazing changes. And we're looking very forward to hopefully improving and changing a lot of people's lives.
Thank you, Ahmed, and again, thank you for the work you're doing. And as you said, this is very complex in a very complex environment. So appreciate everything you've done to help explain all the components, or several of them today, in terms of the time we've had. I'm going to come back to you, Megan, now. Um, Food banks have been in the limelight in the news media for the last few years, and of course, much more since the pandemic started. Food Banks Canada reported in October that a record number of people used food banks in 2022 based on data from the 4,750 food banks across the country. And you can see some of this data on this slide. In addition, food banks have had some misconceptions to contend with. Recently, the executive director of the largest food bank in New Brunswick wrote an opinion piece on CBC to redress the notion that food banks don't address the issue and that they are a band-aid solution, offering clarification that food banks are dealing with a serious and systemic issue and that some critical opinions are not supported by facts. So wondering if you could briefly address this debate about food banks and possibly also offer some final suggestions on policy improvements.
So the first thing I'll say, I always want to make sure that people know is that food banks are not a service provided by or closely affiliated with the government in any community in Canada. We receive a small amount of funding. About 2% of our annual income comes from the government. Everything else comes from charitable community members, foundations, individuals, donors, companies who help make this work. So feeding people in Canada is truly a grassroots effort among charities. And, you know, as I said, food banks were created 40 years ago, and here we are, you know, not feeling very temporary after all. You know, and food insecurity continues to rise, and food banks continue to keep relying entirely on charitable donations. And we have felt that we don't want government funding because it allows us to continue to be able to hold our governments to account and say, if you implement different policies, we won't need to be here. And so, you know, we want to try, and one area for us is improving that those with lived experiences of poverty are part of the decision-making process and part of our policy asks to the government. You know, but we're talking about things like changing social assistance rates, increasing access to affordable housing, you know, basic income pilots, program accessibility, labor laws, unionization. All of these pieces contribute to people's ability to be food secure. But I'll say this about Mississauga, I've never seen it like this in my 14 years at the food bank. You know, like just looking at it pure numbers wise, now April 2020, I realized people, even if they were struggling with hunger, were staying at home. We didn't know what we were facing. But 6,104 people came through our doors, individuals, in the month of April 2020. And in January, we saw almost 13,000 people come through our doors. Every single month is a record-breaking month right now. And if there's not some kind of intervention at government level, it is an unbelievable level of poverty that is growing in our communities. And we're projecting that, you know, by this time next year, we could be up over 20,000 people every single month coming through the doors of the food bank if it keeps going like this. And so, you know, policy solutions and advocating for them is something that the food bank does, but we really need all of you out there in viewer land to also join in and, you know, make poverty an issue that a party can't get elected unless they are going to directly address it. And it may not be affecting you in your life, but I guarantee there is someone in your life, your child's life, a coworker, somebody who is struggling with food insecurity, who can't pay their bills, who is going without. And unless we advocate on their behalf in the political system and see some change, I don't know how the food banks are going to be able to keep up with this level of increase in food insecurity. So for us, there's never been a more important time to address those policy issues from all fronts. We need companies, we need lobbyists, we need individuals, we need elected officials to partner together and create a community that we all want to live in, that's going to work for all of us, because this isn't working. It may be working for some, but it's not working for a lot of people.
Well, those are some shocking pieces of data, Megan, but thank you so much for sharing them with us, because it's clear that solutions will require action on the part of everyone. So I appreciate those very strong messages. And now I'll bring it back to you, Adam, to offer some closing remarks before we move on to the Q&A and field some questions in the chat. What do you think are some policy solutions to reduce food insecurity?
Yeah, I'd echo everything that's been said so far, and I'd go even to put maybe a bit of a finer point on it. And I don't think this is a political statement. We don't have health in every policy in this country. I see some municipalities that think that way, and certainly Mississauga is at the forefront of that. But when you look at other levels of government, health in every policy is not what we have. Megan gave a bunch of examples. I'd add to that even something like the Income Tax Act, where you've actually got some pretty, I'm not a tax expert, but we employ one. We have some pretty powerful disincentives to any employer offering healthy food options in the workplace, because it's viewed as a taxable benefit. Does that make sense? Probably not. So these types of examples, the deeper you look at it, you kind of look under the carpet and you find more and more examples of, well, was this rule that was written in the 1970s or 80s ever designed thinking about the Canada of 2023 with the kind of issues that we're facing? So any potential solutions to food security, any other issue, needs to have long-term sustainable funding, where it's just a pilot. There's nothing wrong with pilots, but that's not going to be successful at achieving a city-wide impact if there isn't sustainable and as much as possible predictable funding. So that's point number one. The second point that I'd make on this is, and I know so many of the organizations on this call know this already, any policy solutions need to be rooted in a process that directly involves and engages with the community that's going to be impacted, either positively or negatively, from the policy change. Policy approaches that aren't consultative and aren't inclusive, and we can all think of those examples that we've seen over the years, that's an approach that needs to be avoided, which probably means having more uncomfortable conversations, taking more time without a fixed agenda with people that we don't normally talk to come up with the best policy levers and approaches to pull on. And lastly, I'll just say that collaborative working groups that cut across traditional sectoral lines. So what I'm talking about here are public-private partnerships. That's, I know in Canada, a somewhat loaded term, but that's something that I believe in because I've seen the tremendously high value. I've had the privilege of working in Denmark recently as last year for a number of months. And I've seen that when it's done well, and it's done the right way, it has tremendous societal benefit. And I think that's what we're going to need to try and get to in Mississauga and in Canada if we want to be making a positive societal impact on this issue.
Well, thank you so much, Adam. And yeah, I love your message about collaboration between all sectors in society to address what is clearly a growing issue, as you've all helped us understand much better today. So we're running out of time. There are lots of great questions in the chat, and I want to thank everyone for submitting their questions. I think we probably just have time for a quick one. I'm wondering if anyone can comment on what can be done to encourage more community gardens in Mississauga. Does anyone have a view on that, or if all of you do?
Ahmed would be the best one on that one.
I was about to say that. Ahmed, go ahead.
We are doing our best. The only thing is that there's how do I say, land is very pricey in Mississauga. It comes at a premium, and the city does have a lot of stipulations in terms of accessibility to put up new spaces. So to put up a brand new community public garden space is quite pricey, and it does require a lot of involvement from the community. It's not an immediate process. It does require getting past some bureaucracy. We are hoping to tear down some of those policies and potentially create easier alleyways to putting up more spaces. The Peel Food Action Council does have a plan to put up approximately 5 to 6 smaller private community gardens specifically in Mississauga this year, and we hope to increase that number as soon as possible with the right advocacy help from our stakeholder organizations.
Oh, again, a great message for us all to take away. Well, that sounds like something to look forward to. Thanks Thanks very much for sharing that. And I want to thank all of you, Megan, Ahmed, and Adam today for bringing your wisdom and experience to this critical discussion. I really learned a lot, and I can't thank you enough, and I'm sure the audience did as well. So I'm now going to hand things over to Glenn Gomulka, Chief Executive Officer of the Community Foundation of Mississauga, for concluding remarks.
Well, thank you, Tanya. Thank you for moderating today's vital conversation. Wow, it was such an interesting and dynamic conversation. And as you said, so many great questions in the chat. You really did a great job of breaking down the complex issues that contribute to food and health insecurity in Mississauga. So I wanted to thank you for moderating today and for all of the time and energy that you give to the foundation, your capacity as a committee member and a board member. We really appreciate everything that you do for the foundation. I also want to thank our panelists as well, Megan, Adam, and Ahmed. Each of you brought such unique and interesting perspectives to today's discussion. I learned a ton today, and I hope our participants did as well. Really quickly wanted to thank the foundation staff and all the volunteers in our community leadership committee who worked hard to bring today's session together, and especially Mohsen Kamal, who did most of the heavy lifting to bring today's session to fruition. Lastly, and most importantly, I want to thank everyone who participated in today's session. I hope you feel inspired to take action on health and food insecurity issues in our community. Please keep the conversation going and feel free to reach out to the foundation with your comments or suggestions for how we can tackle these important issues in our community. And on that note, I wanted to highlight just a couple of things that we're doing at the foundation. One, we've launched a fund for newcomers, which we launched in 2022. It's really to help support newcomers in their settlement journey in Mississauga. The foundation put up $50,000 of matching funding for new fund holders who support this project. So if you have questions about that, please reach out to the foundation. We also last year launched a new corporate granting program, and our corporate partners collectively granted about $11,000 to purchase groceries, clothing, and other supplies for newly arrived Ukrainian families in our community. And lastly, we partnered with Novo Nordisk to administer their Diabetes and Obesity Fund, which provides grants to support community-based interventions that are aimed at preventing type 2 diabetes. So there's a really great grassroots project that we're working on that will address rising health issues that are prevalent among vulnerable populations in our community. So we're really proud of all of the initiatives that we're undertaking. And we're very grateful for the support of our donors and partners who make those projects possible. And those are just some of the ways that the foundation is working to address the issues that we discussed today. Before I let you go, I did want to let you know that we have a third vital conversation coming up in our newcomer series. It will address housing and employment challenges facing newcomers. It's going to be on May 28th at 10 a.m. So please mark the date and time in your calendars and stay tuned for more details as they become available. And with that, I would just like to thank everyone once again for attending today's session. I hope you're all staying warm and safe, and I hope you enjoy the rest of your day. Thank you.